So nothing to disclose. So the complication of sclerotherapy is thrombosis, necrosis, and neurological complication. So thrombosis, so if you see the thrombosis of overall treatment is 0.51%, upper surgery it's 0.54, sclerotherapy is 0.19, and the venous laser therapy is 0.47. But you increase the risk of DVT when more than 10 millimeters of foam was injected. And for high-risk patients undergoing ablation, we suggest pharmacological thromboprophylaxis according to the US guidelines. But for sclerotherapy, the lowest rate of venous thromboembolism, and moreover, it's not usual to do thromboprophylaxis before or after. But we have an algorithm treatment for vein with sclerotherapy according to the vein size. For example, when the vein is more than equal to 4 millimeters and inferior to 6, we prefer to use a polydocanal foam 1%, STS 0.5 to 1%, and again, no more volume of 10 cc by foam. Necrosis, mistakenly injecting the artery companion to the vein. So necrosis after liquid sclerotherapy, it's my fault. It was a long time ago. It was in 1990. But we do not have a color. It was colorless, but we have only ecography and without color. But foam injection to small saphenous veins artery, and you can see on this patient, the gastrocnemius muscles and solar muscles are completely burned. So, but you have, before injecting, you have to identify artery around the vein to be treated, and you see the artery is really close, so you have to find a safe zone. And when you have found a safe zone without artery, you put your probe, and below the probe you draw a line with a pastel pencil, and like this you can have two areas, an examination area where you put your probe, and a puncture area. It will be safe treatment. So standardized procedure guidance from sclerotherapy. 4 stages all done under duplex imaging control. Before injection, detection of possible nearby arteries, vein puncture, check needle position, 3 injection, post-injection, control of filling of the vein by the foam. And the procedure must be entirely done under duplex control. Post-sclerotherapy of telangiectasia and Nicolaus syndrome. So, it doesn't work. No, sorry. So this young lady, 25 years old, coming in your office for unsightly spider vein, and you look at it's very small. But if you put a probe, you will be surprised to see this. You will have artery on this, a very, very short, very close to the skin. You will be amazed to see this. So be careful, even for spider vein. And very energetic flow into this artery. Neurological complication. According to this study published in 2012, there were 12 case reports of cerebral vascular accident with confirmatory brain imaging and 9 reports of transient ischemic accident. There were 0.9% report of neurologic event overall, including TIA, visual and speech disturbance, and 29 cases of reported migraine, 0.26. But if we look at now this study published in 2022 by Nguyen, out of 3,214 reactions, we have 7 stroke, 3 TIA, and stroke and TIA 0.01%. Headaches, 34, visual disturbance 8, migraine 4, headache, visual disturbance and migraine between 1 and 0.1. The risk factor for neurologic complications is right to left chance, historical migraine, large volume of foam, use of physiological gas. Limit of sclerotherapy, it's not a complication, but I have to show you this. Venomo published, and the occlusion rate was for surgery, it was 97%, under venous laser 97%, but for foam it's 51%. But if you look at now, according to the size of the vessel, when the vessel was inferior to 6 millimeters, the occlusion rate was 75%. This is acceptable. 6.8, 50%, superior 9, 37%. So increased vein diameter was associated with localization. In conclusion, thrombosis is a very rare incident,